Good evening. The communities of Chamberlain and Oklahoma had quite a scare this week. As Kellerland Investigates first reported, authorities say that a man who had tested positive for COVID-19 ignored doctors' and officials' orders to self-quarantine and instead visited businesses in both communities. Tonight, Angela Kennedy talks with the Lyman County State's Attorney, Steve Smith, who is frustrated that the state didn't do more and why the state says it acted quickly.
The first thing you need to know is that the Oklahoma man, who's in his 70s, is now in isolation, so he's not a threat to others or in danger himself. The Lyon County State's Attorney tells me a number of threats have come in against the man who knowingly went out in public after being diagnosed. Steve Smith has some strong words for the lack of action by the South Dakota Department of Health and Governor Kristi Noem when it came to containing the man.
Panic spread across Chamberlain and Oklahoma after word went around that the COVID-19 positive man had ignored self-quarantine orders.
The next morning, he decided to bike around town, both Oklahoma and Chamberlain both, and stop into another retail business and engage in commerce that way.
Even after he'd been warned?
Yes.
Lyman County State's Attorney Steve Smith says he tried to get a court order directing the South Dakota Department of Health to utilize law enforcement to take the man into custody until the designated quarantine time had passed and he was symptom-free. According to the governor's office, while not a court order, the Department of Health did issue a public health intervention order to the man, telling him to self-isolate.
I actually consider this whole case to be a matter where the Department of Health showed absolutely no spine in trying to enforce what authority they had, and the governor had no backbone in trying to give these two communities the help that they needed to protect themselves.
So you're saying a public health emergency declared by the governor is the only thing that would have really given you the tools that you need to take care of this?
Had the governor made a declaration of a health emergency, she has certain powers in House Bill 1296 that was passed last week by the state legislature that would have given us tools which we needed to take further action in making sure the public was safe.
In this case, the South Dakota Secretary of Health says the public health intervention order was sufficient. And from the moment the Department of Health was alerted, the man was isolating in his home.
If we go to that step and a person doesn't comply with that order, then we would consider issuing a public health emergency. We will use all the tools available to us to handle any specific situation where a person is not doing what they need to do. And as of this point, we have not had to issue a public health order for that purpose.
But Smith tells Kellerland Investigates that while the details are confidential, it actually took the Highway Patrol stepping in to help isolate the man.
The nature of what happened here isn't something that's going to be a one-time affair in the state, and it's something I think any small town has a fear of happening in their communities. And in the sense of what we all got told could not be done and discovered how little we would be able to actually do.
Smith says he's still considering charging the man for endangering the public's health, but chose not to do so immediately because that would mean bringing him to jail and possibly exposing others to the virus.
Thanks a lot, Angela.